Do you know the warning signs your body might be fighting cancer? It's vital to understand that cancer isn't always silent. In fact, our bodies often send us signals, subtle whispers of changes that could indicate something isn't quite right. These warning signs, if recognized early, can lead to prompt diagnosis and treatment, significantly improving the chances of overcoming this disease. So let's delve into this important topic. Today, we will walk you through the 10 warning signs your body might be fighting cancer. The first warning sign is unexplained weight loss. Now, this isn't about shedding a few pounds after a new workout routine or dietary changes. We're talking about significant weight loss without any apparent reason. You might be eating the same amount or even more, but still see your weight dropping. This can be a sign of several types of cancer, including lung, pancreatic, or stomach cancers. Secondly, we have persistent fatigue. This isn't just feeling a little tired after a long day, but a deep and unrelenting exhaustion that doesn't get better with rest. It's the kind of tiredness that impacts your daily life and doesn't seem to have an obvious cause. Fatigue can be a symptom of many health issues, but it can also be a sign of certain cancers, such as leukemia or colon cancer. Lastly, for this segment, skin changes. Unusual changes to the skin, such as unexplained itching, darker-looking skin, or yellowish skin and eyes could indicate skin cancer or liver cancer. These first 3 signs are just the beginning, so stay tuned for more. Let's dive into the fourth warning sign. It's a shift in bowel or bladder habits. This be extended bouts of diarrhea or constipation, or an unusual appearance to your stool. It might also be an alteration in your urinary habits, like having to urinate more frequently or experiencing discomfort during the brie. These could be red flags for colorectal or bladder cancer. Next up, the 5th warning sign is a persistent cough or trouble breathing. This isn't about a cough due to a common cold. We're referring to a cough that stubbornly persists or progressively worsens. Difficulty breathing might also be a sign, particularly if it's accompanied by chest discomfort. These symptoms could be a signal for lung cancer. And finally, the 6th warning sign is difficulty swallowing. This might mean struggling to swallow food or even liquids. It might also present as a constant sensation of something lodged in your throat. This could be a warning sign for esophageal cancer. As we proceed, bear in mind, catching these signs early is crucial. The 7th warning sign is a sore that does not heal. This is a symptom that is often overlooked, but it's vital to pay attention to it. If you have a persistent sore or ulcer, especially in the mouth or on the skin that does not heal within a few weeks, it's best to seek medical advice. Moving on to the 8th sign, unusual bleeding or discharge. Whether it's from the nose, mouth, nipple, or in urine or stool, it could indicate a problem. While it may not always signal cancer, it's worth getting checked out. The 9th sign is a thickening or lump in the breast or other parts of the body. Many cancers can be felt through the skin, particularly in the breast, testicle, or glands. Regular self-examinations are crucial. Lastly, the 10th sign is indigestion or trouble swallowing. Persistent indigestion or difficulty swallowing may indicate cancer in the esophagus, stomach, or pharynx. Now that we've covered all 10 signs, let's recap. From unexplained weight loss to difficulty swallowing, these are the 10 warning signs your body might be fighting cancer. As we wind down this discussion, let's jog your memory on the 10 signs we've talked about. First, there's unexplained weight loss, which can be a sign that something's amiss in your body. Next, we discussed persistent fatigue, which is more than just feeling tired. It's a constant state of exhaustion. Thirdly, we looked at skin changes. Remember, your skin can tell a lot about your health. Then there's difficulty swallowing, which although might seem common, could be indicative of something more serious. The 5th sign is persistent pain. While pain is your body's way of telling you something is wrong, persistent and unexplained pain could be a sign of cancer. Moving on, we highlighted changes in bowel or bladder habits, followed by sores that don't heal. Sores that are slow to heal or don't heal at all can sometimes be a sign of an underlying disease. The 8th sign is unusual bleeding or discharge, followed by the 9th sign, which is lumps or thickening in the breasts or other parts of the body. And finally, we talked about indigestion or difficulty swallowing. Remember, these signs are not definitive proof of cancer, but they are signals your body sends to tell you something might not be right. Remember, your health is your wealth, and early detection saves lives. Always seek medical advice when you observe these signs. Stay safe and stay healthy.